Of information about the coronavirus on our website as well, so if you want to go there, you can go to ktnv.com. Now, we do wanted to get some insight, I should say, on the coronavirus and the impact here in Clark County.
And we have Dr. Christina Madison on the phone right now from Roseman University out of Henderson. Dr. Madison, it's great to have you with us. I had the chance to interview a couple weeks back when we first heard about the outbreak coming out of Wuhan, China. Given today's news, does that surprise you at all? What was your initial reaction to hearing the first presumptive positive case here in Clark County?
Yeah, that's a really great question. Considering the fact that a majority of our surrounding states have all identified cases, it was really only a matter of time before we saw a potential case here in Nevada. So when I saw the news this morning, it wasn't something of surprise. Obviously, it is something that is now a bigger consideration for us as far as being in the valley and having at this point still suspected confirmed positive because it still needs to be confirmed by the CDC. But again, the Southern Nevada Health District immediately notified us as soon as that person was identified, and that individual has now been put into quarantine, as well as they're doing what we call appropriate contact investigations to find out who that individual has come in contact with. And we do know that that person had recent travel to some of the other areas where we had seen community spread of the virus, like Washington State and Texas. So again, surprise, no. Obviously, it is something now that needs to be a consideration if we do have a confirmed case here in the Valley. But it just makes me more willing to want to talk more about the awareness of the preventative care measures like hand washing and good hygiene and cleaning down frequently touched surfaces, and making sure those who have chronic medical conditions and are older are keeping themselves healthy and well, because we know that the virus has been disproportionately affecting them more severely than, say, the general, more healthy adult.
So, Dr. Madison, let me ask you, what should the concern level be amongst people here in the Valley now that we know there is a confirmed case?
At this point, one person for all of the people that live in Las Vegas. Again, I would still say that risk is low, but we would want to make sure that we're doing those enhanced precautions like hand washing and making sure that we're wiping down frequently touched surfaces. And then making sure that if you do think that you have those symptoms of COVID-19, which include a high fever, cough that's accompanied by shortness of breath, that you are contacting a healthcare provider so that we can get appropriate testing done, and making sure that those individuals are, self-isolated, and making sure that anyone who does think that they may have symptoms isn't inundating the healthcare system, but making sure that they're going to the CDC's website and doing that self-risk assessment to see, are these actual symptoms of COVID-19, or is this really more akin to influenza or the common cold?
Dr. Madison, thanks so much for that information and for your time. I'm sure you'll be hearing more from us in the near future.
Thank you so much for having me.
Well, we do have a full section on our website if you'd like to keep up with the coronavirus and everything happening globally. It includes safety tips, tools, myths, and the status of the virus right now in the country. You can just go ahead and head to ktnv.com.